and welcome to the Oral Health Podcast. So we're sitting down today and having a chat about cancer, as it is World Cancer Day tomorrow. So today you're going to be hearing from me and Karen, as normal, discussing things like oral cancer, the ways cancer can affect your oral health more generally, and also a little bit of advice from us. And then tomorrow you're going to hear from Emma Riley, who is a patron of the Society of British Dental Nurses and has loads of experience with caring for people at the end of their life with their oral care. I know you were a dental nurse for a long time, still are, but work more with me now than actually with patients. But did you ever see any patients with oral health issues related to cancer in your career?
Yeah, when people have been through treatment for cancer or are going through treatment for cancer, their oral health can suffer. Depending where they're having the radiotherapy, obviously the nearer the mouth the radiotherapy is happening, the more problems that they will have, with dry mouth, soreness, that kind of thing. And, eating can be really, really difficult when you've got dry mouth. You almost need something to have a sauce with it all the time. So that can be really uncomfortable. But, chemotherapy has an effect as well. Loss of appetite, soreness in the mouth, feeling nauseous, tiredness, all add to not really wanting to care for our mouths as well as we probably normally would. So it's important to keep that up, but maybe just adjusting the way that you do look after your teeth to try and make it as comfortable as possible for you.
Mm-hmm. And what kind of ways can people adjust their oral health routine if they're finding it troublesome?
I would certainly not be thinking of brushing your teeth when you're feeling really, really tired. If you're very tired first thing in the morning, leave the brushing. Almost leave it until you're going to bed at night. You could do. It's not ideal, but if that is the only way that you're going to be able to do it, we compromise, and we compromise about a lot of things. And people do feel guilty if they're not able to do the things that they're normally doing, and that's not just brushing their teeth. That's a lot of things. But I think that as long as you're doing it at some point when you feel good, when you're feeling at your best, just do it then. And obviously in between you could use a mouthwash. Try and steer clear of one that has alcohol in it, because your mouth does tend to get sore. So just one that is quite a mild one. You could even use salt water, really. Mm-hmm. So anything like that will help to cleanse the mouth or soothe it will help.
Yeah. When we did our mouth cancer series, I spoke to obviously lots of different mouth cancer care professionals, but one of the radiotherapists that we spoke to came up with this analogy, which I quite like, of that radiotherapy is like a gun, so it is shooting the cancer directly, whereas chemotherapy is more like a grenade and it just shoots the whole body's immune system. And when you're having that kind of treatment, it is going to affect loads of parts of the body that maybe you wouldn't expect, and oral health can come into that.
Well, certainly, and when you don't feel like eating, when everything makes you feel nauseous, and you've lost your appetite, the losing weight is a big problem, because you've got to try and keep as strong as possible. So a lot of the dietary advice is to have things that will build you up. Now, often they will be quite high in sugar, the things that you're having. So if you are having sort of the replacement meal powders, mm-hmm. Look at the sugar content. I mean, I'm definitely not saying don't have them, but perhaps you could have them through a straw. You might need a wider straw, because some of them are quite thick in them. Yeah, so they do wider straws that certainly the metal ones that you would have for a smoothie. That will mean that it's in contact with your teeth for less time, so that will help from that point of view. But it's obviously important to get the nutrients into the patients if they're not able to eat food. I know sometimes people are tube fed, which obviously bypasses the mouth completely, but they will still get the dry mouth, and you lose your sense of taste and everything with a dry mouth, so you really don't feel like don't get any enjoyment out of your food that you would normally do. So it is important to continue eating, but perhaps just change what you're eating, but just watch the sugar content.
Yeah, and I know look, every one of us knows someone that's had cancer at this point. It's such a common ailment, and I know personally with my friends and family, those meal replacement shakes are like really heavily recommended. And I know some of the mouth cancer ambassadors we've spoke to, they've said they've had to have lots of these meal shakes and they're awful, they taste disgusting, you don't want them, but that's what you have to keep the nutrients up. So I think that's actually quite a good tip, the having it through a straw if you're able to, just to limit the amount of time it's coated on your teeth.
Yeah, indeed. And there's you trying to swallow things as well. If you've got a mouthful of ulcers, you want to get whatever you're drinking past those ulcers as soon as you can, because it will be painful. So again, if you do have a lot of ulcers, anything that you're drinking, drink it with a straw and it will not touch those parts of your mouth. Obviously water's not going to do it, but if you're having tea or coffee or a juice or something like that, that will sting any sores that you've got there. So using a straw will bypass that and make your mouth feel a little bit more comfortable.
And we'll touch on mouth cancer really quickly because it is World Cancer Day, but I don't want to spend too much time on it just because we've done an awful lot on mouth cancer recently with our podcast, because we had Mouth Cancer Action Month. But if we can just do like a whistle-stop tour of what are the signs and symptoms, what are the risk factors, and how often you should check for mouth cancer, just really basic stuff like that in case people haven't heard it and want to know about it.
Yeah, I mean, what we're looking for is red or white patches in the mouth, ulcers that haven't healed within 3 weeks, a persistent hoarseness of the voice. If you look in the mirror and you're not symmetrical, you can feel a lump or a swelling anywhere in your face. If you stick your tongue out and it tilts to one side, all of those are things that really need to be checked out. Not necessarily something that is mouth cancer, but it is always better to get it checked out as soon as you notice something like that. So 3 weeks of any of those symptoms, you really should be going to your dentist. I do understand that access to dentists at the moment is difficult for some people. Yeah. So in those cases, go to your doctor. Your doctor can equally refer you to have anything checked out that he can't diagnose.
Yeah, and I know GPs as well as dentists, I think now it's really troublesome to get an appointment for so many people, and I don't want to skate over that because it's true. Like, this is the advice we give, but we also know it's not always the easiest path. Yeah.
But if you are worried about something, most doctors, if you're registered with the doctor, will offer emergency slots. It's worth trying and persevering to get in to see somebody, because sooner that referral, you can be referred on an urgent pathway and you will be seen a couple of weeks. So yeah. It is better to do that. I mean, as for risk factors, smoking, any tobacco product, drinking alcohol, smoking and drinking alcohol does double your risk of oral cancer. Men over 40 are more at risk. It is now, mouth cancer is now in the top 10 of male cancers, so it's certainly on the rise for that category. And HPV, which is the
Yeah.
virus that causes cervical cancer. So that is something that is on the rise as well. So you can get mouth cancer. I mean, we are looking now at, sort of our next generation of children will have been offered the vaccine. So if they are offered the HPV vaccine at school, and now that is both girls and boys, it is really, really important to take up that offer.
Yeah, absolutely. And I think it's such a great shame that I didn't know about HPV risks until I started working with the foundation. I had my jabs, I'm pretty aware, but I had no clue that it could affect my mouth. I was like, oh, you find out about it when you go for your smear, and that's kind of it.
Yeah, we do get people saying, well, why do boys need to have it? They haven't got a cervix. So sometimes it is a bit of a more uncomfortable conversation, probably more for us than it is the people that we're speaking to. But once you've had a conversation with young teenagers about oral sex and their sort of their practices and that kind of thing, the more you do it, the less embarrassing it is, and it just it seems to be part of a normal conversation. And the more normal we are about talking about it, the less embarrassed the teenagers are, and they just take it as further advice that they've been given. So in PSHE, I think they talk about all sorts of things. So it's probably more our uncomfortability than it is for the teenager. And once we're over that, then it's a really important message, because it is the largest growing reason for mouth cancer.
Yeah, and mouth cancer is the biggest cancer we kind of focus on because of the Oral Health Foundation. That's where our expertise kind of lie. But it's nice to also discuss wider cancer effects on oral health, and in particular radiotherapy. If you get radiotherapy in the head or neck region, it's going to affect your oral health, and it's going to affect it long past when you're having your radiotherapy, which again, something I had no idea about.
Yeah, certainly. I mean, I do know somebody who had radiotherapy head and neck, and this is probably 10 years ago, and they still have problems with the dry mouth. It's completely knocked out the salivary glands, so everything has a gravy on it or a sauce on it or something to make a bit of moisture so it's easier to swallow. So there are things that people are going to have to think about and make adjustments for.
Is there anything else we can discuss about cancer's effects on oral health that we haven't mentioned? So I know we've discussed things like the diet and treatments, and is there any areas that we haven't touched on, do you think?
Well, I think that when we're looking at brushing teeth, there are some lovely sort of special care brushes that are so soft. They feel like velvet when you put them on your hand. But using that kind of brush is not going to traumatize already sore mouths. So if you can get around with something like that, somebody doesn't have any teeth, then they do sort of little foam things on a stick. It looks like you're probably too young, but when the gladiators used to be on the TV, when they used to knock each other off the post.
Oh no, I know gladiators. Yeah, those big foam things. That's actually it's a good description of what those things look like. Just like teeny tiny versions of those.
Tiny versions of those. So you can actually get around and clean the gums with those as well, and it does make the mouth much more comfortable, because you know what it's like. You wake up in the morning and your mouth doesn't feel clean. You don't feel dressed almost, because it's not a nice feeling. So finding a special care toothbrush, there are some on the market. Your dentist will probably be able to recommend one, but you want a super soft one, even softer than a sensitive brush. You want a really nice, as I say, they're normally called special care, and they're really lovely and soft, and you can get in there and just very gently clean. If you do the bottom once, and then a few hours later you do the top, that's fine. Just as long as you are doing it at some point and making it most comfortable for you.
Yeah, 100%. Like, just to echo what you've said there, Karen, if you can only manage to do it once a day, or some days you can't manage at all, then there isn't any judgment from anybody. I know it sounds obvious to say, but I know people will feel it, but there isn't anything from us that...
Not at all. Not at all. Use a rinse. Use a rinse if you can't brush, because fatigue is a huge part of the treatment for cancers, and it's debilitating. It is absolutely it's not like feeling I feel a bit tired. It's not like that at all. Fatigue just takes everything out of your body, and you really can't lift your head up sometimes. So exactly. Using a rinse, what works for you works for us, basically.
Now remember, you can follow us at Dental Health Org on all social medias, apart from Instagram. On Instagram we are at Oral Health Foundation. More information can be found at both mouthcancer.org and dentalhealth.org online as well. Now come back tomorrow to listen to Emma and Stacey from the Oral Health Foundation talk a little bit more about late stage cancers and how that affects your oral health.